The cannabis community is a diverse set of people from all walks of life, conservative and liberal, black and white, straight and gay, rich and poor, and everyone in between. Learn more about the people we are freeing from adult marijuana prohibition in our Cannabis Community Chat.
Welcome back, everybody. Half past the hour, and joining us on this Veterans Day, we've got one of my favorite veterans. It's Michael Krawitz from Veterans for Medical Cannabis Access. Michael, how are you? Hello, Michael. Do we have you? Michael Krawitz trying to get you on the line. All right, let's see if we dial this call out again. If we can't get Michael on the line, he's been fighting for the veterans and their access to medical cannabis for years now, a frequent guest of our show, and one of the people who was instrumental in getting the Veterans Administration to end their practice of denying their pain medications, denying opioid pain medications through pain contracts. And he was able to get the Veterans Administration to relent on that in the states where medical marijuana is allowed by state law. And he's been, like I said, a frequent guest of the show. He was just trying to dial us back. We'll see if we can't get him on the line now. Michael Krawitz with Veterans for Medical Cannabis Access. Hold on just a moment while we dial through. And there we go. Michael, it's Russ. Can you hear me?
He'll be there in 1 second. We've been having some phone problems.
Hello.
Hello, Michael. It's Russ. How are you?
Hey, sorry about the technical difficulties up here in the mountains of southwestern Virginia. How you doing, Russ?
Doing great. It's kind of windy down here in Portland, Oregon. I wasn't sure if it was on my end.
No, I think it's on my end here.
All right. Well, a happy and solemn Veterans Day to you, sir. And we bring you on because I recently received a press release from California NORML of a couple veterans telling their stories about being denied pain medications. And apparently there's been some scheduling changes to some of these opioid prescription drugs that are causing some doctors to rethink how much they're giving out, especially to those veterans who might be medical cannabis patients. What can you tell us about this? Any updates?
Well, there's kind of three things that are working through the system. One is as a result of the massive scandal that I'm sure everyone is familiar with the VA. The Inspector General has looked at a lot of the VA's practices, and one of the things they weighed in on was prescribing practices of so-called opiates or controlled substances, and they complained that the VA wasn't doing enough spot checking, that they were over-prescribing. And in fact, that lines up with a lot of the veterans' complaints that we get, that the VA is happy to give them a big bag full of pills and send them home. And then on top of that, you do have that rescheduling, which puts a whole new class of drugs in Schedule 2 with that tighter control and the increased scrutiny and the drug testing and everything that comes along with it. The meantime, the VA has been spreading kind of quietly, I guess, too quietly for our taste, a medical marijuana policy and a clear ethics doctrine that, when followed by the doctors, would allow veterans to use marijuana at the state level and coordinate that with whatever treatments are appropriate at the VA, maybe even including opiates or controlled medications. And in this case, in Southern California, we've got an administrator. It's kind of an unusual case. A lot of times we'll have trouble with an individual doctor, maybe even an individual hospital administrator. We've gotten the VA now at the highest levels to come out with policy we agree with. And we're often, by proxy, the spokesperson for the VA because the VA doesn't want to comment about marijuana. I think rightfully so. So, we're okay with that. We don't mind speaking for the VA. We try our best not to say the wrong thing. I don't know that I've ever been corrected by the VA, knock on wood, right? But at the same time, we have this mid-level administrator somewhere in San Diego, over 1.5 million vets, controlling 6 VA hospitals, that just says basically, okay, no more medical marijuana users in my hospital. If you're using marijuana, you're going to have your opiates taken away and you're going to be tapered down. And hopefully the scolding that I imagine that administrator is getting right now internally in the VA will correct this. If not, we're prepared. And when I say we, a lot of activists in Southern California and California NORML, we have a pretty good sized cadre of a team down there ready to go if the VA isn't able to correct this on its own, really in short order.
Is there any estimate to how many veterans this is affecting right now? Any numbers?
Well, like I said, it's the actual VISN, the group of hospitals that this administrator, who is not a medical doctor and who is the acting director of that group, is over 6 VA hospitals, and the total coverage is 1.5 million vets. Now, in that, we recognize that, it's maybe a minority of veterans that are using medical marijuana, but still a minority of 1.5 million is a significant number. And we always look at, a handful of veterans in one area as a spike that indicates kind of the tip of the mountain. So we just kind of extrapolate that. If I'm getting a few complaints, Ellen at California Normal's getting a few complaints are coming in through other channels, there's a major problem there. I mean, one complaint once in a while is a provider problem. A big cluster like that indicates a systemic problem. And we went after it as such, and I think, the vets involved were very keen to, make sure they got the facility to say up front and in writing what the policy was they were following. And because we had that, memo or ad hoc policy in hand, we were able to respond appropriately.
Another topic on Veterans Day that, we should perhaps, address here is this alarming stat that I caught in the Normal blog that veterans are committing suicide at the rate of 22 every day. And this was posited against a recent study showing in the Journal of the American Medical Association that medical cannabis states have lower rates of opiate-induced fatalities and lower rates of suicide. This just seems to me criminal that we would deny veterans this access to medical cannabis when we have such an epidemic of veteran suicide.
Well, I've tried to look at that, and I've tried to be objective and trying to figure out why that is. And if you're looking at a little baby, a small child that's suffering from some sort of epileptic fit or seizure, and the mom or the dad or the doctor, whoever administers some sort of highly, CBD-rich medical marijuana product, and then that kid stops having seizures and is all of a sudden okay, that's really dramatic. It's very, it's very easy to get your brain around. And, for me to say, okay, I've got really good reason that if you throw cannabis at this population of vets, we will statistically lower their suicide rate, it's too esoteric. It's not real enough for the American people. Otherwise, I think they would be completely outraged to know that, some of these deaths, at least some of them, and, I point to, drugs that are being given to these vets willy-nilly inside the system right now that actually have as a warning on the label that it might increase the risk of suicide. So, if you reduce the amount of that drug, just like if you reduce the opiates and you lower the overdose, it's sensible to say if you reduce the use of these inappropriate drugs that are pharmaceutical and replace some of them with cannabis, so we can reduce some of that death, as well as the direct action, and that's a direct action that you're talking about, pharmaceutical action where cannabis is an effective medicine and it alleviates somehow the urge to commit suicide in some patients. It's obvious.
Yeah, and, with respect to other dealing with mental health issues, there's also the situation of post-traumatic stress that is dealt with by our nation's veterans, and we've seen so far some really good reports on the use of medical cannabis to cope with that. I know Dr. Seisley, the researcher at University of Arizona, now trying to get on at UNLV to do those studies, is still kind of in a holding pattern. Any new information on PTSD and medical cannabis? Yes,
we've kind of, I guess, I don't like to use these terms usually, but I really kind of feel like we're at a tipping point here with post-traumatic stress. I work with Veterans for Medical Cannabis Access, and we're kind of a loose grassroots network of vets throughout the country, and we're connected with a lot of efforts throughout the country where we started with just the one state where local activists had created the qualification in New Mexico for post-traumatic stress as a qualifying condition, and from that one state we now have 8 states that list PTSD as a qualifying condition, and then of course California and Massachusetts where they don't have such a list, restraining doctors. And we're soon to add more. We've been working really hard in Maryland. We're hopeful that the new draft rules will reflect post-traumatic stress addition there, and onward. And we're fighting, ironically, in Colorado and Washington State are our last two kind of battlegrounds where we've again and again presented the evidence to the commission and again been rebuffed basically with no counterargument. There's at this point, at this late state, where we have published reports of cannabis, being used as an adjunct for post-traumatic stress down in New Mexico with great results, published studies, and a great record now in so many states. Working nationally, I've never received a complaint from anyone, from a provider or a patient saying that they tried to use cannabis for post-traumatic stress and the benefits didn't outweigh the risk. I've never heard that. And we've never gotten any credible argument from anyone. The psychiatric community, psychiatric medical doctors, seem to be very knee-jerk against us having post-traumatic stress added to state laws for medical marijuana. It's a turf battle. It's a battle over 1995 and whether marijuana is medicine is most of their arguments, all their arguments, in fact. So, that's the lay of the land. That's where we're at. I think we're going to see, every new state that adds a medical marijuana program from this point on, hopefully add post-traumatic stress as a matter of course, if they're going to have a list.
Yeah. Is there any indication that the reticence of Colorado or Washington to add PTSD is due to the fact they have legalized cannabis for everyone and they see no need to add it?
Actually, it's the opposite. In Colorado especially, the issue that was raised and brought to the voters very effectively, I have to tip my hat to the brilliance of Brian Vicente and Mason Tavert and the Marijuana Policy Project team and everybody that worked so hard in Colorado. And they saw, in their wisdom, without my input, to put a vet out in front of this. And Sean Azarati got on TV and said, as a veteran, I can't access marijuana through the state medical marijuana program for my post-traumatic stress because they're a bunch of beep, 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 and I have to go basically and legalize marijuana so I have access. And sure enough, when they legalized marijuana in Colorado, the very first customer on TV around the world was Sean Azarati, buying his package of marijuana that he's legally able to do so for his post-traumatic stress. Without having to go through the state medical marijuana program. So, in fact, their resistance to add post-traumatic stress as a qualifying condition became one of the bricks in the effort to legalize marijuana. And, I just find it kind of a strange irony. You've been tailing Kevin Sabat around. You know about irony. Yeah. We have this situation where it was supposed to be a camel's nose under the tent. It was supposed to be medical marijuana was leading to legalization. That was the whole point, remember? Well, I'm out here working on medical access for vets, and we're struggling to get programs set up in Washington State and Colorado. And it's not helping that legalization has happened, but it's very ironic that legalization has happened.
Wow. Michael Krawitz, Veterans for Medical Cannabis Access, thank you for all the work you're doing. Contact information if someone wants to get in touch with you.
I think the easiest way is we have a website and all that, but the Facebook is probably the easiest. Go to Facebook and /USA.VMCA, Veterans for Medical Cannabis Access. And certainly anybody out there that wants more information about the VA policy or any veteran that's having issues inside the VA, if it's not something that we can help guide you to some help with,